Martin Merrick, delighted you could join us today, Professor of Child Health in the Institute of Tropical Diseases Research in Calabar, the University of Calabar, Cross River State in Nigeria. It's always a pleasure to work with you, Martin, as you know.
Me too, I'm always a pleasure, and thanks for bringing me back to the school.
Martin, you've been working with us for 14 years, and it's been a great pleasure to work on a number of projects. I understand at the moment you're updating a review related to malaria in children. Would you like to tell us about that?
Yeah, this is a pretty hot topic, actually. For a long time, people have been trying to prevent malaria by giving medicines to children. But there's been issues about harm and all that. But this review is looking at a very important question around giving children who live in areas where malaria is seasonal, giving them medicines during this period only. And this actually is aimed at reducing both malaria illnesses and deaths and all the problems that go with malaria. So this review is looking at all those outcomes and to see how this intervention has affected these outcomes. And it's an interesting one, an important one.
How does it impact on health? What's sort of the size of the effect?
Consistently, all the 8 trials, which pulled a little over 10,000 children, have consistently shown at least 40% reduction in malaria illness. Both the severe forms and the mild forms of malaria are reduced by at least 40%, and I think that's a huge gain to make from such a simple intervention. And the good thing is that you're giving this only for 3 months, or at the most 4 months in the year, once every month. And these are drugs that are already in use, so there's no real issue about fresh questions about harm to these children. So this is really a good. I hope when it becomes some policy sometime soon, it will really give some benefits.
Martin, you've done a number of influential reviews. One was a Cochrane review on hand washing, another on preventing adolescent pregnancy. Has this influenced the way you interact with policymakers at state or federal level in your country?
Well, in all the work we do, we have worked closely with people who are working at different levels of the Ministry of Health. And over the years, they've come to recognize our work. And therefore now when they have need to know the truth about interventions or issues around treatment or prevention, they stop by us. And actually, for instance, about once every year before the Parliament makes budget, they ask the Ministry of Health to come and defend things. And the malaria program takes me along because the parliamentarians ask questions about whether these things work or whether there is harm. So issues around that. And I think it shows that they have trust in what we do and the information that comes out of our work. So that's one. And of course, we also more recently have been interacting with the media. The media community around Calabar also stop by us often to check out issues around interventions that work or don't work in healthcare, ranging from controversial issues like the use of condom to normal things that we do regularly, like whether or not typhoid fever should be treated with some form of test or not. And these are issues that several reviews have either been completed on or are currently being addressed.
Martin, Nigeria has been famous in the past for its medical research and then went through a bit of a hiatus, and it's now building up again. Would you like to comment on how your work impacts on quality of medical research in your country?
Well, maybe I should talk about our own institution. Maybe that's one way of looking at it, because we have an interesting group of young people who are now doing a lot of good work designing, interestingly, strong research proposals. I think this has come out of the skills they gained from learning how to critically appraise other people's research, which is what you do when you do systematic reviewing. So talking about our own institution, yes, we have learned from criticizing others. We've learned how to do it better. And then secondly, we also have grown some collaboration with people from working in the Cochrane collaboration. One good example is that we've just been finishing one huge, continent-wide trial looking at 4 anti-malarias, and we work with people in Liverpool, in Antwerp, in Uganda, and this has come out of the collaboration that we've grown through our work with the Cochrane collaboration and our little efforts in systematic reviewing. People are beginning to think that we have some credibility and some things to offer in terms of academic quality of academic work. So we're beginning to have more research linkages at institutional level, that is. But I guess that's happening in many parts of Nigeria too. So things are getting better. Things are getting better.
Thank you very much for joining us today. It's been great that you've been able to talk with us. Thank you very much, and we look forward to hearing more about your institute and your work over the coming years.
Thank you, Paul.